My name is Brenda Ray. I'm a nursing student at Arizona State University. I will be giving you a brief presentation on the implementation of my Capstone project, addressing medication reconciliation. The objective of my project was to implement a medication reconciliation tool into a primary care office with the goal of improving the reconciliation process to be more efficient and accurate than previous methods used. The tool sheet is designed to be used during every office visit for a total of up to 15 visits. Additionally, patients receive a copy of the updated medication list after each visit and provided with education on the importance of accurate medication management, sharing the list with other healthcare providers, and keeping the copy of their medication list in their wallet or purse. The importance of accurate medication reconciliation is well documented. Shepard, Mohorn, Jakob, and May warn adverse drug reactions causing death are serious national concerns, which result from medication errors such as drug interactions or inaccurate dosing. Spalla and Castillo report patients taking multiple drugs often do not remember the names, doses, or purpose of the medication they take. Thus, errors are often made due to incomplete information or a patient's lack of understanding regarding their treatment. A recent study found the most common medication reconciliation errors were errors of omission. John lists additional risk factors for increased incidence of medication errors, such as elderly age, comorbidities, or multiple diagnoses, and the use of more than one pharmacy. Bajar, McKeek, and Katoff-Burrell note the most apparent benefits to accurate medication management include a decreased risk for medication errors, increased patient safety, and increased quality of care. John and Jalob agree the use of a medication reconciliation tool, which follows a patient across the continuum of care, positively impacts the medication reconciliation process between the various healthcare settings a patient may require for treatment. Coletti et al. Suggest by encouraging patients to take on an active role in managing their medication, they're further encouraged to become more active in developing a treatment regimen with their provider, additionally improving adherence. The use of a medication list, which can be used as a medication reconciliation tool across the continuum of care, is a simple yet effective method to prevent medication errors and patient harm. The implementation of the project was carried out over the course of 4 weeks. The first week involved meeting with Dr. P to obtain permission to implement the medication toolsheet, presenting the toolsheet to Dr. P and staff, educating staff on the use of the tool and the importance of accurate medication reconciliation, and implementing the tool into practice. During weeks 2 and 3, we continued implementing the toolsheet and addressing issues and concerns which arose. During the 4th week, I presented staff with a satisfaction survey to determine the success of the project. Analysis of the completed surveys confirmed the tool sheet was an easy-to-use tool which improved the medication reconciliation process and facilitated patient education on medication management. The results were reported and discussed with Dr. P and staff. It was decided to permanently adopt the medication reconciliation tool sheet as part of the patient charts going forward. Implementation of the toolsheet improved the process of medication reconciliation at this primary care office to be easier and more efficient. Accurate medication reconciliation is an important aspect of nursing care, as it can prevent serious patient harm and even death. The primary care physician's office has a pivotal role in preparing patients with the tools and education necessary to manage their health and safety. Patients were pleased with the education provided and the copy of the medication list given to them after each visit. The establishment of a tool to aid in the medication reconciliation process and providing patients with the medication list to share with all other healthcare providers is a large step forward towards preventing medication errors and, most importantly, increasing patient safety.